Second segment of the show for today. The topic is African American adolescents and health issues dealing with health well-being. And we have with us the professor of sociology at Tennessee State University, Dr. KSanford. Sanford, let's continue our discussion by having you to continue in a real sense some of the information that you were giving us.
Okay, as I was stating, it is an epidemic at this particular point in America. And we are leading the world with this particular issue, and I would like to suggest again that here in the state of Tennessee, we are 3rd to 4th in the nation in obesity. And I would also like to say how this can become, as we look at the African American community, a cultural type of a component within our community. This whole legacy of eating habits and what we should eat and what we should not eat, and the amount of exercise we get and the amount that we do not get becomes somewhat of a part of culture. And in many instances, it impacts our families because people are dying at early ages because of this epidemic. But I would like to say that the study that I've been doing has been very much involved with 18 to 25-year-old students at Tennessee State University, and a large percentage of them, the largest percentage of them, will have a BMI ratio that is higher than the average that it should be. That suggests that they are into that overweight to leading into the obesity category. And so one of the aims of it is to try to, not to make fun of groups of people, but to try to get them to see that there are some cultural elements very much involved in this issue, and it can be prevented. If you know where you are, then you can start doing two things that I would like your audience to understand. You can be very specific about the diet that you're eating, as well as increasing your exercise, your mobility. As you may know, many might go to Walmart and drive around the lot 4 or 5 times to get closest to the door as they can, rather than just walking from the back of the lot to the front. So one of the aims is try to encourage the students to find out what that BMI ratio is, and then to change their diet, stop eating trans fats, stop eating a lot of foods that are high in fat content, and to increase their exercise. And then they would see a difference. And if they can start that difference, it will really improve their health and health status. We feel that this research is groundbreaking in that if we want to come up with a theoretical model that we would share with them the importance of doing it, so they won't just say, well, I've tried it before, now I did it, now I'm off of it, now I'm back overweight again. So we have a particular theoretical model that we are hoping that will impact people that are in our audience, and we can get them on track to improve their diets and to increase their exercise.
Have you suggested some reason that many individuals who might find themselves in these conditions, that what are some of the reasons that they give?
Well, I think that, well, as I've studied, their reasons is, of course, just being in family. You know, grandmothers, great-grandparents, when they go to Thanksgiving or to other holiday dinners, or into the daily activities of just eating, it's there and in the home, and that's what they're eating. I think even, you know, the site, Dr. Phil has a book out on obesity, and he said if you just remove all fat stuff from your kitchen, then you won't have it there. But we are pushed in our society to supersize everything and to eat fast foods and not eat correctly. And this is one of the major problems. So we try to get them to identify that. And if I may just mention very briefly this theoretical model, we are hoping that will help others is holistic. We want to see the social psychology that might be very much involved in stress and depression that might be in existence in one's everyday life, that then may cause a person to feel that they're eating and overeating from an endearing way. They're pacifying hurt feelings. A second one, we want them to understand that some of our habits in eating might be connected to history. You know, for 244 years of enslavement, 81 years of Jim Crow laws leading into segregation, and during that institution of slavery that occurred for so long here in America, parts of animals were just left that this particular African American group had to eat in order to have protein, and it endearingly became soul food. So we would then cook with some types of foods within our greens, which are excellent for you, but it might be high content in salt. And with the fat back, the lard, and all these things, we say the ham hock, if we didn't have it in there, then it's not tasting good. These are the things we have to try to change so that we can eat healthy and then exercise more and then hopefully improve.
So all of this, in a real sense, Dr. Sanford, it really boils down to individual responsibility. Individuals simply have to understand that they have a responsibility in order to take care of their health, and that unless they take care of their health, the whole range of outcomes that you've already indicated, diabetes, strokes, and etc., that's the consequence, and shorter lives. Is that what we're saying?
Absolutely, that's exactly what we're saying.
That there's no way to get out of having a short life if you don't take care of, deal with this issue.
And it's worse now because we're finding from pre-kindergarten up to adolescence, there's already an obesity issue that is occurring, and many times kids are having type 2 diabetes, and then females are too, and then what is happening, we're finding females to have strokes leading into their 30s, where historically it may have been into their 60s or late 50s and 60s, but the obesity is just there at such an early age, and then they're carrying it over into their early young adulthood age that's going to cause devastating health problems. So it is individual, but I also want to point out that it's influenced by group and institutions. You see, there's a big market out there for institutions to keep groups of people taking pills and medications for high blood pressure and hypertension. Well, you have a healthcare system where people make billions of dollars. The industries make billions of dollars in selling pills for people to take for diabetes and for high blood pressure and hypertension. So if that group of people if they got on a good health plan and a good exercise plan and curtail their habits and got back into good health, then they would need to take those pills, therefore they would need to buy them. But the larger industry would like people in a real sense to stay unhealthy. You see, but then they can continue to make billions of dollars, and so it's a big problem.
So health is not in the best interest of the pharmaceuticals.
It really is.
Is that what we're saying?
Absolutely, or the medical industry. And then, you know, medical doctors, when you go in, the first thing they would share with a person that is in the obese category was to try to lose weight. And then when they come back in for the next, say, visit, then they are heavier than they were the first time. So they will say, well, it's really nothing I can do to help this person because they are not doing what I'm saying. The only thing I can do is offer you some medication to be a Band-Aid for a symptom or a problem that is much worse and is uncontrollable.
Now, the Obama administration has a health issue in terms of prevention and et cetera. Do you think that this is a method whereby we might be able to get a handle on? This is so widespread, Doctor, that it almost seems as if it's almost a problem that's almost impossible to deal with, the way we're trying to deal with it now.
It's an epidemic, and it is a huge problem demographically throughout the United States. I think the Obama administration has an excellent plan, and Michelle Obama, the First Lady, is actually
and of course
trying to help.
We're going to pick that up, and we'll be back with our audience following this very, very short commercial break.